Hi everyone, my name is Sito Govega and this is our interview session presentation from our group. This is our group members, Abang Nur Iqmal, Mas Aminul Zahir, Erika, Umi Mardina, Eli, Zeta Govega, Valvinder, Adeline, Khaizat and Elvina. This is our interviewee personal background. We have interviewed a COVID-19 patient and a nurse. The COVID-19 patient is Cik Asfanisha Farzana binti Suai. She is 22 years old from Kampung Tambirat, Asajaya, Sarawak. She is a final year student at the University of Malaysia, Sabah, UMS. 6 out of 15 family members have been infected with COVID-19 on July 2021. Then we interviewed a nurse, which is Puan Wendy Marcel. Puan Wendy Marcel is a nurse. She is 32 years old. She is from Sabah, and she has been working as a nurse at Hospital Queen Elizabeth Sabah for 7 years. She is married and have 2 children. Since each group had 10 members, our group was split into 2 small teams. 5 members will interview a survivor of COVID-19, while the remaining members will interview a nurse. We interviewed a COVID-19 survivor, Cik Asfanisha, on 20 November 2021 through WebEx. These are the main points we discovered from our interview with a COVID-19 survivor. She was infected by her nephew. They went to do a swab test on July 15. She was transferred to a hotel named Place to Stay for 2 weeks with her family for isolation and quarantine order. The nurses in the quarantine center gave them medicine, vitamin C to cure sore throat, fever, and headache. According to Che Asfanisha, she had symptoms such as loss of sense of smell and taste. The challenge she had was obtaining a new vaccination appointment because she missed it due to being a COVID-19 positive patient and enduring quarantine. Another difficulty she faced was that she had to undergo self-quarantine for another 2 weeks at her home and was unable to go out and meet anyone, including her own friends. She says that being in the house for an extended period of time has made her bored and unhappy due to the sheer number of family members. The next interview session was with a frontliner, which is a nurse. We interviewed a frontliner, Puan Wendy, on 27 November through Zoom. These are the main points that we have discovered from our interview with frontliner. Mrs. Wendy's challenge was that she had to return to work after maternity leave to assist in the treatment of COVID-19 patients in the ICU section. Mr. Wendy stated that individuals working in the section were at high risk. The second difficulty is that they must wear personal protective equipment to prevent the infection from spreading. Mrs. Wendy stated that wearing the personal protective equipment was extremely uncomfortable owing to sweating and trouble breathing. The next challenge is she was not having enough time to spend with her newborn and other children due to her employment as a nurse, as well as being separated with her from her husband who worked in Singapore and was stranded there throughout the pandemic. Mrs. Wendy overcome challenges when treating COVID-19 patients by emphasizing the importance of teamwork. Mrs. Wendy mentioned that even though each nurse is only assigned to one patient, they should all work together to care for the patient. Nurses who were not working in the COVID-19 patient section also assisted the group of nurses who were working in the section. Mrs. Wendy also stated that getting enough sleep is important for dealing with emotion and stress. Communicating with group members on WhatsApp in case of misunderstandings or conflict is also a way for them to manage their emotion and stress. Mrs. Wendy also stated that praying helped her and her group calm while handling the treatment of COVID-19 patient.
Jadi soalan yang pertama, sejak bilakah Anda mula merawat pesakit COVID-19 dan apakah antara cabaran yang Anda rasa susah untuk Anda tempuhi sepanjang tempoh pandemik sekarang?
Sejak COVID ini wujud sejak 2019 kan, yang bulan 12. Tapi masa itu saya pregnant. Pas itu memang ada sudah pasien COVID lah, tapi tidak banyak masa itu. Jadi yang pregnant masa itu di dipilih-pilih tidak jaga COVID lah sebab high risk kan. Jadi bulan 2 seberana, cuti bersalin lagi 3 bulan. Mei 2020 baru start jaga COVID lah. Oh ya, saya bertugas di ICU. Lupa pula. Di ICU, start Mei itu saya lepas bersalin, kembali bekerja. Cabaran merawat pesakit COVID, yang first memang risiko jangkitan yang tinggi lah untuk kami sendiri. Lepas tu cabaran yang kedua mau pakai full PPE. Kalau guna tu sangat tidak salah-salah, kau boleh berpeluh-peluh, tidak macam sesak nafas kalau terlampau banyak pergerakan. Lagi di ICU bukan tempat yang kurang kerja, orang bilang yang sangat kritikal kan, pasien dia apa-apa pun boleh berlaku. Jadi di sana kau punya pergerakan memang banyak lah. Lepas tu sudah kau full PPE, satu shift tu kami kerja shift kan 7 jam kalau siang, malam 10 jam. Kalau di dalam tu 7 jam, 7 jam, 10 jam, kau tidak boleh makan, minum, toilet memang tidak dapat lah. Jadi kau mesti bertahan, itulah cabarannya.
Soalan pertama, bagaimanakah cara Anda mengatasi cabaran ketika merawat pesakit COVID?
Kalau di tempat kerja, kalau kau sebab limited pergerakan, sangat sibuk, memang yang cara dia salah satu mesti ada teamwork antara kami lah, rekan kerja. Sebab kau tidak akan dapat handle tu satu, walaupun kau kena assign satu pesakit, satu nurse, tapi kadang-kadang kalau tidak cukup staff, 2 pesakit, 1 nurse, memang kau tidak akan dapat buat satu orang semua. Jadi kau mesti juga minta kawan kau tolong. Itulah antara salah satu strategi dia, teamwork.
Okay, can you tell us how you being infected? Is it from your close contact or from your environment or from where your work, or how you get infected? Can you tell us about that?
I was infected by my nephew the day we went to do swab test on 15 July, and my nephew is 5 years old, and he was my close contact because he is the son of my brother-in-law who was the first infected by COVID-19.
In what treatment did you receive for your COVID?
They gave me some medicine to cure fever, cough, sore throat, headache, and some vitamin C. That's all.
Okay, this is for extra. Can you just explain how that? Can you explain more about how being infected? Is it really like everyone said that it was really hard, or you know? How does it feel? Did it really worse or what?
At the quarantine place, nothing special happens. Just we stay in one place for 2 weeks, and they gave us 3 meals a day. And I had an ordinary symptomatic, to be accurately, like having the sense of smell and taste loss. And I have a fever that more severe than usual, and it took me more than 1 week to fully recover. And I'm also having trouble after I was fully recover from COVID-19. I'm having some trouble getting a vaccine appointment since I miss it. So I contact various clinic to schedule an appointment.